The two most common types of thyroid disease are hypothyroidism and hyperthyroidism, two conditions that sound similar but exist on opposite ends of the spectrum. Can you give us a basic rundown of what separates the two aside from a few letters?
When that hormone is too high, meaning that the gland is producing too much, or too low because the gland is not able to produce the right amount, it's underactive, it's crippled, it's sluggish, then it produces too little thyroid hormone, and that can cause what we call hypothyroidism. And the other end of the spectrum is hyperthyroidism if the hormone level is too high. The symptoms of both entities are usually different, but there are a few symptoms that overlap. For example, feeling tired or fatigue in general as a non-specific symptom can happen in either condition. There is general conception that if you have an underactive thyroid, you will gain weight, but if you have an overactive thyroid, you will lose weight. In 90% of the time, that's true. However, people with hyperthyroidism, not all of them lose weight. Some of them do gain weight because hyperthyroidism not just stimulates your metabolism to burn more calories, but it also stimulates your hunger centers. There are defining symptoms. For example, if somebody has hyperthyroidism, they will have a rapid heart rate. An underactive thyroid person would have a slow heart rate. They may have some irregular beats because those heart cells are not functioning optimally. With hyperthyroidism, the chances of frequent bowel movement or loose bowels are higher, as opposed to hypothyroidism, where the GI tract is more sluggish, it's more slower. In hypothyroidism, you have dry skin. You don't see that with hyperthyroidism. You may see other skin changes in hyperthyroidism if they are hyper. If they are more irritable, more easy to snap, as opposed to hypothyroidism when they're feeling subdued, more depressed.
So when we talk about treating and managing these kind of functional conditions or issues, I'm assuming that each one of these has a different approach?
The only solution that we have is to optimize the thyroid hormone level. So if the gland is overactive and producing too much, we have to either give a medicine to slow it down to where it should be, or get rid of the gland completely. On the other side, if the gland is underactive and producing too little thyroid hormone, then we supplement with exogenous thyroid hormone or thyroid hormone in a pill form that the person takes to supplement their body with the amount that is missing that the thyroid cannot make anymore. So this is where the professional comes in, works with the patient to get them optimized to the best level they should be at.